Dr. Dhanesh for the. So now, Dr. Dhanesh, you can start your session now.
Okay, sir. Thank you, Dr. Sadat Said and Sahani sir. It's over to Dr. To Mr. Shalu Rajan to moderate the English session.
Okay. Am I audible?
Yes, yes.
Okay. Okay, then thank you so much, our beloved Dr. Sadat Said. You gave us a very wonderful session. We have got a lot of information from your valuable session. Now we are going to the international session by English language. Then good morning, good afternoon, and good evening to all my beloved doctors and homeopathy lovers. Now we are here gathering together to attend our 1529-day session conducted by International Forum for Promoting Homeopathy. This is our 1 hour session. After this session, our Malayalam webinar will be started at 9:30 to 10:30. First of all, I introduce myself. My name is Shalu Rajan, our steering committee member. Today is our session's moderator. Before this session, we want to take a 1-minute silent prayer. Please be silent here. Okay, then today's our guest is our beloved Dr. MUKTINDER Singh from Ludhiana. He has been 27 years of clinical experience in homeopathic field, and also he has been 25 years experience in teaching field. He is working as professor and HOD of Repertory Department at Sri Guru Nanak Dev Medical College in Ludhiana. He is one of the guest faculty at London College of Homeopathy in UK. Then he has a huge experience as the speaker at international seminar on disaster management at Air Force Auditorium, New Delhi by Pebble Hill University, Italy. He has got a lot of rewards and achievements like Lifetime Achievement Award by Delhi Board of Homeopathy, and he was awarded a Best Motivational Speaker by FSAU Trust. So he has won many awards on his profession. Today he is here with us and will talk to us on the subject of CURED case of breast atrophy with repertorial analysis and MATERIA MEDICA. He has came in this platform many times and shared a lot of his experience here today. We are eagerly waiting for his valuable words. Now we warmly welcome to our beloved Dr. MUKTINDER Singh to this platform. Good evening, Doctor.
Thank you, Dr. Shalu Rajan, Dr. Dinesh, and respected Dr. Sahni sir, and whole of the beautiful people in this IFPH platform, Dr. Abdul Salam from Qatar, and other people who have been blessing me with their wishes and many a time. So I'm happy to be the part of this family, because this is one of the platform where we talk only of the studies and homeopathy, so which connects us all. So thank you for inviting me, giving me this opportunity to talk in front of this august presence audience. And now I think I should start my case without taking much time. So I'm sharing my screen. So today I'll be talking about one of my cases from my practice, where I learned some new insight into some new remedy which I was using for many years, but I have never understood the context of the remedy in this way. So this is a start way I started the case. It is a case of atrophy of breast. This was a lady. This is of not the real picture. So this is a lady who was 26 years old, female. And this is a case from my clinic records. This case came to me in 2009. So chief complaints, if we say that location was in chest, and sensation was she feels that her breast is very small and it's getting further smaller. So, and when asked about the history, she said that I have started this after I got married. After marriage, her breast size is started decreasing. So with that, what is affecting her is she's getting depression, inferiority complex, and fear of rejection. These are the three things which have been coming with the chief complaint. So after marriage, she has started feeling low. The physical generals, if I talk, was no specific symptom of appetite or hunger, or food craving was sweet, salty, rice, pizza, ice cream. There was no specific version found. Thirst was again, it was some very not very clear. She said that I'm health conscious, so I take a lot of water, and she likes cold water. And thermal was even not clear, because before her child was born, before conception, she was a chilly patient. And now after the birth of baby, she feels that I feel comparatively hotter than earlier. So I was not able to assess her thermals in the true sense. Stool was normal, urine was normal, sweating was scanty, sleep was normal, and during tension, she cannot sleep properly. So she said that when I'm stressed, so my sleep gets disturbed. So, and her dream, constant dream is that her husband is going with other girls, which was quite a true circumstance. I will just elaborate this in my further slides. So if I talk of the past history, so she suffered a severe episode of a dengue intermittent type of fever and was hospitalized at the age of 11 years. And now she's 26, and since age of 16 years, she's having that cervical neck pain. And she oftenly get congestion of chest in harvest season. And in August 2008 and March 2009, she had a miscarriage after her marriage. She got married in. So when she was in ninth standard, she used to do crash dieting. What she said, she has always been aspiring to make her career in the hospitality industry, especially the air hostess. She wanted to be air hostess. So she said that I was very health conscious. I used to do crash dieting. Then she had irregular with that. Once he started having periods, and she was very strict on her diet and very strict on her regime due diet. So she started getting hormonal troubles, irregular period, hair fall, and weak liver. And then she taken breast enhancer capsule course for 5 months. She said that when I was in puberty, I started with the growth of my breast, secondary characters were developing, but still I was not satisfied by figure. And then I started taking some breast enhancement capsule course for 5 months. So when she was pregnant, she had thyroid problem, which went away after she delivered a baby. And during pregnancy, she gained almost 30 kg of weight. So she has always been very conscious about her weight. So during pregnancy, only she gained almost 30 kg of weight and had the thyroid problem. So see here we can see that this lady has been always conscious about her breast size. And this again now is our presenting complaint that after marriage, her breast size rather than increasing, it has started shrinking now. So father had blood cancer, mother had cervical spondylitis. And now coming on to the mental journals, she gets angry and irritated very easily. So she's an irritable kind of lady. So, and during that anger, she stops talking to anybody, and instead she weeps and shrieks. So when she's angry, she will start shrieking and weeping without talking to anyone, without sharing that what is her problem. And when angry, she takes some drugs that numb her body. So she has been into the glamour world. She was once that on the ramp walk, she was a model. Then she was a air hostess. So she is fond of taking. She is in habit of taking occasional the chemical drugs. Before marriage, She used to get nervous very easily. So her basic nature was she was a very sensitive girl who used to get nervous on small things. She hardly shares her feeling with only and with anyone. Only she says that partially I share my emotions with my younger sister. She's suspicious for her husband. Now, here comes the main complaints. What happened that she, when she was into the glamour world, she was herself a model and was working into one of the international airlines. She got attracted toward a boy who was himself a male model and who was very smart and very good figure, and he was a kind of very coquettish boy who used to attract many girls. So she says that my husband, I always knew is a party animal. So he has a lifestyle where he'll go to the parties, pubs, whole night parties, staying outside home. But she gets angry only with her husband because he doesn't answer her calls. So she gets angry. She says, "Okay, I'm okay. I know this is his basic nature. He can go anywhere." But I get angry when she has come. My husband says that he will return by 10 p.m. or 12 in midnight. But when he won't returns, he stops responding to her calls. And when he is in party and because of his misbehavior, gets very angry. So when he is not attending the call, he's not telling. And this girl, we already discussed that she is a very nervous and anticipatory anxiety girl. So she used to wake up whole night and then go to the already her schedule of this air hostess was in the shift, and after that she has to be vigilant on her husband. So this has spoiled her whole of the comfort and her problem. So she was an air hostess before, but her husband asked her to quit. So another thing which happened in her married life was, so she both were working into the glamour industry and she was air hostess, but then her husband started forcing her that you quit the job because he said that I want a baby. So you have to, so in this air hostess job, you cannot keep working while you are making your family, and during pregnancy, you cannot carry out with your job. So she was forced to quit her job. Now she wants to go out for job, but her husband doesn't allow her. Earlier, he had a plea that you should sacrifice your career for our family. Now her baby is grown up. He has a girl child, and which is grown. Now she wants to join back her job, and she has an offer also. But her husband is not allowing her to join the job again. So with this, all that she gets frustrated because of all these reasons. She doesn't like to stay home, wants to be a working woman. Earlier, she was fun loving. So I told, okay, this is a situation now. What is your basic nature? She said, I am a very nervous girl, but I'm a fun loving girl. Want to go for party. I myself also want to. So I used to go with my husband. She used to think about her husband all the time. So she was in love. She said that I love, it's a love marriage. So I have gone against my parents to love this boy. But his behavior has changed after marriage. So she said there was no good start of her married life because her husband is wrong or part of because of his relationship. So she said that earlier I was very happy that I have got a very good, loving, caring husband. But later on, I realized that he is a flirt. So he is, as he was with me, he is with many more girls. So this thing started affecting their relationship. So otherwise, she is a very sensitive girl and very much concerned about opinion of others. So and when she is sad or gets angry, she gets frustrated, shrieks on her husband, shouts at family members. But she is very much non-sharing, non-expressive of her grief. So, till now we have talked about the case. So I would like you to have the your presence, and you tell me what you learned from or what you have understood. So you please give your inputs. If you want, I can read the case again. So we'll save it, solve it to what. So Dr. Amita says that it is expression of emotions. Good. What else? You please all let us be interactive. Hello, Bob. So what you learned from case, you should share your experience as I have narrated the case. What are ambitious professional? Okay, very good. Very good. So I want more input so that we cheated feeling. Okay. Neglected feeling. Yes. Disappointment, ailment from disappointed love, ailment from suppressed grief, ailment from emotion, ambitious, sensitive to other opinion, neglected, love sick, ambition forsaken, suspicious, her trust broke. Yes. She is suspicious. Yes, of course. But here suspicion is a kind of defense of her because her husband is actually a cheating bag. Ignatia, okay. Let's not jump to the medicine. So when I asked her, good inputs, I'm happy. Any more inputs? So before can we think about vanity? Why vanity? This is her glamour is her profession. Deceived being, yes. Reserved. Delusion doomed. Why? Dr. Harpreet, why delusion doomed? Loss of ambition. Wants to look beautiful as her profession demands. Yes. So that is quite obvious. Disappointed in love. But what happening is her situation is rather making her uglier, not in terms of that every lady has a lot of possession, because this is one of the major sign of femininity. Your breasts, they are the representation of motherhood and femininity both. So it is there is some issue. Yes, honor me. Breast means feeding, and breast also means as the motherhood and means that femininity. So her femininity means her identity is at somewhere at stake. So we have to think in these terms, that because this is affecting her genetic makeup, her genes, her femininity, her hormones, everything is at stake. So suppression is not just superficial, it is at a very deep level. It is very psychotic kind of suppression where her defense, her body shape, which going against her. So when I asked her, very good input, I'm very happy. So see, being when we are talking of Dr. Pathania, when we are talking of some profession, so supposing you are treating a case of a dancer and she has a makeup or heavy makeup on her face and wearing very gaudy clothes, so you will not take that as a symptom because this is demand of her profession. But if it's a normal lady is coming up with an attire as if she's a dancer, then we'll take it as vanity. So this is her profession. This is what her ambition and what her profession is. So professional demands doesn't mean that this is your external looks, and so this doesn't reflect your mind. So important thing is that I asked her a question, that if you are a working lady, so why don't you retaliate to your husband if he is not loyal to you? She said that he is even sometimes physically abusive and physically beats her. She is taking so in further investigation, further case taking, she told that he has even once tried for that this modern trend of abnormal sexual behavior of wife swapping. He said that he once started convincing me and tried to force me to sleep with her friend, his friend, because her husband wanted to sleep with the wife of that his her friend. So she said that I was very uncomfortable. So I quitted in between, but I was not very strong. I started getting convinced with his talks. And this way, she has been taking many things which she doesn't want to be, because she has a kind of possession and weak will into this relation. She said that I want this man to stay in my life, although he is unloyal, although he is not very loyal to me, although he is not very good man, he is cheater, he is a liar, he is a drug addict, all that. Despite that, I want, she's clinging to her. So here, the main whole story has been revolving around this symptom of, means we have a rubric into our repertory that undertake things opposed to her intentions. Because what she has been doing is she has been very discomfortable, very much disagree, and still she's continuing with this relation. So I wanted, and see this rubric, we all feel sometime that we need to compromise in our life, we need to undertake many things which we don't want to do. But I rarely take this rubric because here this thing has affected her identity, her body structure, her whole of personality has been crushed, a kind of she has been. So this rubric becomes relevant over here. I hardly take any small rubrics, or I hardly in a habit of taking small kind of rubrics. But here I have chosen this PQRS because whole of the case, she was not able, she was not comfortable leaving her profession, but she undertook that. Now she wants to join back, still her husband is not doing, and she is trying to please her husband and crushing her own personality. So there we have talked this kind of trait where you find that actions are contrary to intentions and undertaking things opposed to her intentions. So these two rubrics, if we take that phosphorus and CPR common remedies in it. Otherwise, pulsatilla is one who would yield to the circumstances for consolation, for because pulsatilla is a weak-willed character. Same way, ruta is a remedy which will have lot of hurts, lot of deceives. Still, he will continue with the things. And thuja again having ugly feeling, again that having. So these are the remedies which come to our mind, because here we need a remedy which is like not into it and still doing it. So these are the rubrics. Because I have cut short my presentation because we are short of time. So I wanted to show you the rubrics and materia medica. So I will read the remedy from Allen's Encyclopedia. He thinks of things which he does not wish to think. So about this remedy, I prescribed her the remedy sepia, because sepia is mentioned in the terms of flat-chested woman and the woman. So if we see into the sepia personality, so I will be talking you with all you people about the sepia personality. Sepia is a fish remedy where in proving, I'm not talking of the source, I'm talking of the proving. He thinks of things which he does not wish to think, or uses expression he knows are incorrect. Undertake those things which are opposed to his intention, and finds such contradiction with himself that it puts him in a very uncomfortable and uneasy mood. So sepia pathology, even in the after 24 hours improving. So here I want to emphasize on this particular rubric that this is a proving rubric which has reflected into the repertory. So here the sepia, this is a zest of sepia personality. Sepia are atony, sepia are relaxed, in means they have the atony and this musculature, and their body shape and everything goes just like indifferent to everything. So sepia, we in acute sometime we prescribe that sepia is an indifferent remedy. But in this case, you have seen that sepia, she is a kind of narcissist personality. She is a kind of very self-love personality. So this becomes a very contradictory picture of sepia. Otherwise, we see sepia as indifferent, not bothered about her looks, not bothered about her what is going on in the surrounding. She's like a machine, she's like a robot. She won't because of sepia in first stage is very sensitive, very ambitious, like an animal remedy, very approaching personality, very happy-go-lucky personality. But as the disappointments come in sepia life, she started taking all her emotions in on the backstage. So here we can compare it with the magnesium. So magnesium will do the similar act. Magnesiums, they will just um, start keeping their emotions repressed, but will try to please everyone. So here the Sepia comes very close to, because she doesn't want to be abandoned. She doesn't want to be left out. So here Sepia, if you see, carcinosin and CP are two major remedies of ailment from domination. So when someone tries to dominate a CPR, CPR will not retaliate, will not react, but will start undertaking the things which she doesn't want, which she is not comfortable. And ultimately, all that, taking the things which are uncomfortable, it will start affecting their health, will start creating a freckles on their face. It will start creating that prolapse of uterus, lot of licoria. She will start losing weight. She will start losing interest in everything, but keep doing. So CPI it sometimes appears to us sometimes a very diligent remedy. So this was the rubric which the Vermeulen Concordant says that undertake things opposed to his intention, anger in the morning, anger from contradiction, anger about former vexations, about past event, anxiety during flashes of heat, aversion to husband, aversion to members of the family, censorious, intolerant of contradiction, delusion she is alone in the graveyard. Now, here, her life has become like a graveyard, no emotions. So in even sometime in religious teaching, we said that if you want to be a devotee, you have to be like a dead body, means having no will of yourself. So here the pathology, as Dr. Kent says, pathology has affected her will. So here she, if you see the rubrics, when I was narrating the history, here the lady was always getting angry, and then she's just killing her emotion, just suppressing her emotion, just keeping herself on the second stage. Now, who gets affected? Honor wounded, someone mentioned, someone said love. Now, the Platina, Sepia, all these personality, they are basically self-lovers, but when they are not given due importance, so sometimes they start losing the interest and they become at bad state. So delusion, she is alone in the graveyard. Someone calls on waking, she is mutilated body. So in dreams, she is saying that cut means her emotions, her personality, and she is like a dead person. So this is the pathology where her atrophy is coming from. What is atrophy? Is when the nutrition to a part is not given, the part starts getting kind of starved. So here on three instances, earlier she used to get crash dieting, she used to starve herself. Now she has starved herself of her emotions, and now we are seeing atrophy in one of her part. So Sepia is again a remedy for starvation. So undertake things opposed to intention and suspicious. So I just took two rubrics. So medicine given was Sepia. So I'm not going into the details of much medicine. So I will like to teach this Sepia because this is one of the polycrest remedies and we can get wonderful results with this remedy. So I would focus more of teaching this medicine today. So theme of Sepia, we have following things on Sepia as part of general family picture with associated C remedies. So most of the C remedies, they are dissatisfied, they are independent. They have congestive passive, their distance and grudge. These are the things in which the sepia patient's mind revolves around. So here we see this lady is very dissatisfied with her life, but she has a desire to be independent. So this cuttlefish always tries to stay alone, stay away from everything. And if someone tries to intrude their space, they will release an ink which will blind the creature approaching them. So their facade, their defense is to just make a kind of colorful picture, and so that others get distracted by those colors, but she would fled away. She will not show her emotions. So they are they maintain a distance from other, and they will not forget that thing. If someone forgets that, then it is not sepia. So they will keep it inside. So sepia is a kind of cuttlefish. So sea remedies in general, they have a need to stay in a safe environment. We usually used to utter a rhyme that मछली जल की रानी है, जीवन उसका पानी है, हाथ लगाओ डर जाएगी, बाहर निकालो मर जाएगी, 2 दिन रखो सड़ जाएगी. मतलब the sepia is a kind of a remedy. Fish are the kind of, we have many fish remedies like murex, like Emperor Gracia, like sepia, like other remedies, starfish, we have astrias. So all these remedies they have in common is that they need to stay in safe environment. Water is their safe environment. Still they are not, they hardly, there are few fishes like dolphin or other fishes who would try to approach, but most of the fishes, they evade the human or anything coming near them. So there is an environment of protection, nourishment, emotional warmth, and safety, like cornucopia of the mother's womb. So they just need, they just, it's a kind of an infant stage, it's a kind of an embryo stage where they need protection. So they will set up a basic frame of existence to achieve this, to be comfortably contained. So they need an environment where they are comfortable, where they are contained. So it is sometime it appears like calcarea, we know that oyster shell, but here they don't have a hard protection again around them. As calcarea, we know oyster shell, they create a kind of hard protection, skull type structure around them, very hard bony structure. But here in the fishes, they don't create, so they evade, they either stay or they would create a kind of facade where they can still be sensitive and they fly away from the situation. So at the same time, the sea remedies characterized by need of separation or need to individualize. Now here the individualization, their identity and need for separation becomes. So here that need for separation, because we know that all the renal patients, kidney is the organ of water, organ of the hydration, organ of the aqua, sea organ of our body. And that also the kidney patients, they, when they are feeling of separation from the family, they are not given that always creating their space, they are not getting their space, so they will just get affected. So CPI that way becomes a very good, all fish remedies, they become very good renal failure remedies in this term. So here the need to individualize, need to maintain their individuality, fight for their individuality, and kind of a struggle for their existence is very important. To have a sense of separation, CPI creates an attitude of independence. So that sense of separation, CPI people will have a kind of independence, like someone has written in the comment that libertinism. So libertinism is a kind of trait where you want to be independent, where you want to fight for your identity, and your freedom is defined by your own self. It is not the freedom. My definition of freedom and your definition of freedom is different. Someone says that I'm alone in my home, and so that is my freedom. But someone will say that I go out, that is my freedom. So their sense of independence is defined, but also one of distance emotionally. So when they feel that emotionally they are not nurtured, when emotionally they are not satisfied, emotionally they are not being protective and secondary, so their reaction becomes independent. So this is the root cause of the indifference or that state of sepia. So desire for separation is a conflict situation bringing about dissatisfaction. The expressed antagonism of self in the repertory. If you see, I will show the self antagonism. If you, I will just share the repertory screen here. So self contradiction. So we usually say that anacardium is the medicine. So anacardium, but antagonism, if we say that antagonism with herself, is my screen visible? Hello, can anyone tell me?
Yes, sir.
Yes, yes, yes,
Yes,
sir.
sir. Yes, sir.
It is
Everything
good.
fine, sir.
So
Everything fine.
here we will connect the dots that uh, uh, taking things opposed to her intention, and here antagonism with herself. So we usually talk of anacardium, that anacardium has two wheels. All these remedies, anacardium, aurum, kalika, black can, lac, salksaf, sepia, and thuja, they do present. Now here it need to be differentiate with the rubric that they have contempt for self. Now antagonism for self and contempt for self are two different things. There are some common remedies. Contempt is when you are not defending yourself, when you are blaming yourself. So contemptuous of self. These are the two traits which we need, because these are very deep traits. And if you say that Scipia is not in contemptuous of self, because here also she wants, okay, I should have my identity, I should rejoin my jail. But Aurum, I once came across a lady, she was uh, mm, a very strong lady. But when she came to me, her husband brought to me, she said that she has been a very commanding and very strong lady throughout her life. But now she has lost all her confidence. Due to some reasons in the family, her decisions were not taken into the true sense, and her in-laws, they blamed her out of way. And while she has been very diligent lady, and now she has lost all confidence, and now she is not able to do anything. She says that I have many servants at home, but I cannot even command them. So she starts feeling that she is worthless. So Thuja and Aurum, both these remedies here, they are very common. Antagonism with self and contemptuous of self and no worth. So if you see, I'm comparing this remedy here. So if someone, you find someone who feels worthless, Aurum and Thuja. See now, this why I'm saying this as a syphilitic trait. You see these two remedies, although this is not my remedies today. So when the circumstances of life, they are kind of pushing you to a corner, and as a reaction, you start doubting yourself, you start antagonizing yourself, you start blaming yourself, and you start feeling worthless. So this Thuja and Aurum. Thuja is chief antipsychotic remedy. Psychosis is the defense. But Aurum here is a very means. Aurum we see as a remedy. Sometime if the time would permit, I will take the Aurum remedies in toto. But here the Aurum becomes very prominent remedy in such cases, because Aurum thinks that I have a worth. But when her worth is not recognized, so she start believing in a very syphilitic stage, in very cancer cases, in very deep depression cases, where they decide that they should end their life because they are not worthy. So gold, we all know, is always the top priced. Always it's one of the most reliable metal, where if you invest in gold, you will get always good returns. It will never depreciate, it will always appreciate. So this desire for deep appreciation becomes their identity. But if they are not given that identity, if they are not given, so they become antagonizing me. So my main rubric was, I'm talking of self-antagonism. So self-antagonism, what does it means? That like anacardium, I'm having two wheels. On one wheel, I'm saying good thing. My one mind, my saying good, other saying bad. So same way Kalika, it's a very dominating. Aurum is a very dominating remedy. What is in Lacan is a remedy where the person start comparing himself with others. That as you say, when this There's a bitch who has delivered the babies after labor. She becomes very aggressive. She start feeling that she's very ugly. So this ugliness, the Dr. Shankaran has beautifully written this remedy in the terms of that she will start thinking that she is less smarter to her beautiful sister. Her beautiful sisters get more important, so she is not beautiful enough. I remember one of the lady, she were on the day of her marriage when she came to her in-laws for the first day. The neighborhood ladies, they started coming to see her. Or there's a ceremony that muh dikhai kind of thing, that they see the face of the newlywed daughter-in-law, and they just give some money in. And so the ladies, she was sitting on that window side, and two ladies, they were going out of their home, and they was talking that Shushma's daughter-in-law is not that beautiful. So that words hit her so badly that she lost all the confidence on first day of her marriage, first day of her in-laws day. And her mother-in-law was replying that, "Oh, kya kar sakte hain?" So that crushed all that her confidence, and she become a lack can lady. So when someone feels that, he starts believing that he is not enough. So antagonism with herself is a rubric of such a depth that you have your own willpower. You will convict yourself, you will manifest your thoughts, you will stand with your thoughts, but sometimes you have contradictory thoughts. It is different from irresolution. Irresolution, when you are not able to decide, you are confused between two things. But here you are say, you, even if you antagonize a small kid, an animal, a pet, he will retaliate that it is against my wish. But when you are started accepting that, okay, I sacrifice my wish, so this rubric becomes very important. So this is a syphilitic rubric, self-harming rubric, self-sacrificing rubric. As Dr. Vijay has said, that it is a kind of rubric of her autoimmunity. So many of the ladies of this multiple sclerosis, SLE, this rheumatoid arthritis. So when their personality are crushed to such a level that they have the self-doubt and they just antagonize themselves, then if you use this rubric as a tool, you will get beautiful result. I hope I am able to convey what I wanted to tell you. So to have a sense of separation, CPR creates an attitude of independence, also of distance emotionally. This desire for separation is conflict situation, bringing about dissatisfaction. So this is represented as antagonism of self in the repertory. So achievement of separation has an element of grudge. So this separation, that I have separated myself from those painful circumstances, but she's keeping that grudge. So which can be understood as a type of projection onto the outer world, and relationship of resentment felt. So there one is not able to or prevented from separation or individualization. So here that becomes an identity issue, identity crisis. However, the problem is always inside rather than outside. So whatever we are suffering, if a platina is feeling that he is taller and beautiful and worthy than others, it is his inner environment, not the outer environment. Same way, whatever we suffer, if I suffer self-antagonism, if I suffer inferiority complex or superiority complex, it is my inner environment. So CPR has created such an inner environment. So this in a compendium book by David Little, it is written that CPI is a worn-out mother, the oversensitive medium, the cuttlefish, an emotional ocean, camouflage, a smoke screen. So when someone is just masking, natramur also mask their emotion. But CPA has become so non-expressive of her emotions that she has kind of created a smiling face. So loss of love is her, indifferent is her, unresponsiveness, disfigurement, dependence versus independence, affection caused by long history of domination by others. These are some of the rubrics which we get. Sexual abuse. So CPR is a kind of, I have seen CPR emerging as OCD patient after the childhood sexual abuse. If she was raped, if she was mishandled by some male, some watchman, or some, even I had a lady who was suffering from psoriasis, and her own cousin brother or the step brother have sexually molested her in childhood. So that becomes so indifferent to life. All her ambitions, they were deceived, and they being raped, sexual excesses, debauchery, ailment caused by being alone, celibacy. Celibacy is when you are forced not to indulge in sexual practice either by your religious reasons or whatever. So there is, you see many cults who abstain from sex and then they suffer. So being unmarried, being continence, all these patients. So you will find a sepia, classical sepia picture in all these. The persona of sepia is, aura of sepia appears as conscientious person. So sepia is as compared to our picture which we have set into our mind of an indifferent person. Otherwise, sepia basically is a very conscientious person who feel a deep sense of duty. Here I am comparing sepia with aurum. So they are like aurum has a strong sense of duty. Sepia also has a strong sense of duty towards their family, friends. They are devoted, loyal, and faithful, and are often overburdened by their responsibility. So Sepia is a personality who would be taking all that on you without being any involved into herself would be. So these are the mothers who have stress of their children, exam, their food, husband. Even though husband is very abusive and not very caring, still they are very dedicated and loyal persons. So CPS suit patients that are struggling with dichotomy between dependence and independence. So on one way, they want to be an independent lady. On other way, they seem to be dependent. As in this case, she is not able to, she is not ready to join without consent of husband. She can join. So here this conflict, so it is a deep ongoing conflict that she is losing her identity, she is losing her femininity, she is losing her personality at cost of pleasing her husband. So ailment from, if you go to the repertory, you'll get sepia mentioned in ailment, affection caused by long history of domination, as I've already had mentioned, sexual abuse, being raped, sexual excess, debauchery, ailment caused by being alone, celibacy, being unmarried, continence, all these you will find sepia. Ailment caused by disappointment, deception, grief, sorrow, care, disappointed, unhappy, love, as you have already mentioned into the discussion in the chat that you got these rubrics. Symptoms caused by bad news, business cares, business failures, being scorned, embarrassment, mortification, humiliation, and chagrin. So worn out mother has a man avoiding Amazon. So she's a strong lady who is avoiding having any relationship with man. So sometimes they are the widows, sometimes they are the divorcees, sometimes they are unmarried, but they would not be running behind the men and they will not allow anyone to enter their aura. If someone tries to approach them, they will just be fool or make a kind of situation that other person stops taking interest in them. The oversensitive, cuttlefish, and emotional ocean camouflage a smoke screen. So their camouflage is they will release a ink which will create a kind of a camouflage that they are invisible to others. So they will lose contact, they will stop responding to their calls, they will stop responding to their messages if someone is trying to come close. Loss of love, indifference, unresponsiveness, disfigurement, dependence versus independence. So well adapted to the persons of dark hair, rigid fiber, but mild and easy disposition. Now, you will find the same wording into the Ignatia in Allen keynotes, that it is written for the heart because the black hairs, dark rigid fibers represent a strong personality. But in Ignatia also, but very emotional, contradictory. Same way CPI is antagonism remedy. They seems to be strong, but internally they are mild and easy disposition, especially suitable for the person with dark hair and for women, especially during pregnancy, in childbed and while nursing. So any gallstones, any thyroid symptoms coming during pregnancy, so you should think of sepia. A woman who has the hips of a well-built man, is not built for childbearing. She cannot perform the functions of a woman without becoming relaxed in the pelvic organ and tissue. Such a build is a sepia build, very tall, slim, narrow, straight from shoulder all the way down. So you will find as you call that, a female figure is there. She has issue from shoulder to breast to the narrow waist, and then hips, and then legs. So that shape is missing in sepia. It is like a parallel shape. So this has become a kind of a totally cold woman. That's why we get that rubric aversion to sex, aversion to touch. So all her hormones have gone in dominant. So Murphy says clinical repertory is amenorrhea, appetite deprived, dysmenorrhea, dyspepsia, eczema, face yellow, freckle, gleat, gonorrhea, gravel, leukorrhea, libido low, liver spots, liver torpid. So these are objective symptoms: menopause, menstruation disorder, mental disorder, miscarriage tendency, morning sickness, neuralgias, pregnancy disorders, pruritus, urine incontinence. So all these clinical picture would be best fitting to a sepia. The ill effect of anger and vexation. So sepia has been a journey where the anger has been the major component of her emotions suppression. Blows, injury, overlifting, falls, or we know that sepia is a washerwoman remedy. Sepia, but here the very important modality is sepia feels very much relaxed by dancing. So getting wet, laundry works, no ear, boiled milk, pork, tobacco, fat, hormones, birth control pills. So abortions, ailment from abortions, or the Saheli or the menstrual the remedies which are given to avoid the menstrual dates, if they are supposing you have a function or you have some corporate responsibilities, and you take pills to postpone your menstrual or prepone your menstrual cycle. So hysterectomy, childbirth, where this femininity has been deeply crushed. The sepia patient, he has been overcome by the world and finds herself defeated. The light is too bright, sound too loud, children are too noisy, husband is too rough, everything is stronger than she, and she constantly attacks and overcomes her. So surrounding, so she becomes so sensitive to the lights, so sensitive to the sound. The child of the children, they are making noise, but she will not stop reacting. So that she has to overcome that. The world has become nothing but an attack. And now she needs sepia as the cuttlefish and kraken. So need it when they want to protect themselves from importunity of their enemies. So they will just escape. They will become the low in hearing. उनको वो जो आवाज है जो तंग करती थी, the things which used to bother her has stopped bothering her. Sepia discloses its mental symptom, the mollusk quality, which is inherited in this remedy. It strengthens the mind's defensive tendencies, hardens the power of resistance against the environment, which is growing too overwhelming, and helps to restore the balance between man and its surrounding world. So aversion to man. When the water darkened by the sepia ink gradually begins to clear up again, the enemies have disappeared. So this is her defense, that she will create a kind of personality. If husband is scolding her, husband is beating her, she will just not react, don't talk back, and then ultimately the husband will go away. So this, when she will come out of her shell, she will go into her own self, and when come out, that situation is over. The courage has been restored and a new attempt can be made to exist. Now, what happened in this case was, after we prescribed sepia 1 and 10, I'm sorry, the 3 doses were given at a monthly interval. So what happened, her father, as I earlier told, suffered blood cancer, and he was a big businessman. So that he expired, and she was to take the responsibility of business, and earlier she was avoiding, her father was sick. But after sepia, she developed that courage. So one day, what happened was, she was bearing all that for last 5 years, and she was not getting that courage. Her antagonism was not allowing her to take the decision. What happened after CPR? Her courage becomes so strong that once she got a news that her husband is into some Delhi market, in South X market, with some prominent model, and even media is present over there. They are on some opening ceremony of some saloon. So she was with some Bollywood actress, and she got that courage. She went there and created a kind of scene. She slapped her husband in front of, earlier her husband used to beat her. She slapped her husband in front of media. This was even a news in that 2009 into that. And she just slapped her husband, abused that girl, which was her latest girlfriend, and took a decision and just divorced her husband. And she took her girl daughter along with and started handling the business of her father. And then she started becoming very successful. And now, even now, she's one of very prominent figure of Delhi. And she's taking her business to such a high levels that after that, her husband approached her and apologized her, but she refused. So what CPR did in this case, you can see it other way, that CPR broke the family. No, I will say that CPR gave the courage to that sufferer, to that abused girl who was becoming a kind of slave to her husband for her insecurity. Now the CPR gave her courage to take the decision, and now she has been a happy, a beautiful girl, and a very successful woman. So courage has been restored and new attempt can be made to exist. This CPR.
Hi, doctor.
Yes.
I remind you that time, so please forgive
I'm
me.
winding up in 2-3 minutes. So Cinderella
Okay.
sitting alone and in despair among the ashes in the kitchen, faced with the impossible task of separating the grain from chaff, is suddenly surrounded by a flock of doves who protect her and help her to finish the task. So this is the CPR personality. After you prescribe CPR, the CPR it used the proper way. The persona of CPR, I have already told. So Philip Ballet says that CPR, persona of CPR picture is independent, witch, dancer, courtesan, shrew, drudge-apathy, and utopia. Catherine Coulter has said that overworked housewife, career woman, the complainer. Murphy say that this sexual desire is the main arena of the CPR, pushing out sensation in womb, impending walking desire. So that's why the CPR would sit the crossed legs most of the time. So these are the some of the rubrics which I have taken from MATERIA MEDICA to support to understand this trait. So as organizers have already warned me to stop my talk, so I'm ready. Thank you for listening to me. Any questions you can ask. We are left with the 2 minutes. So the CPI is a remedy which we can use into our practice to make the decision making of the person affected by CPR. Even the personality confusion and antagonism of with self, undertaking things opposed to intention. If their decisions are affecting your personality, the personality of the patient, and crushing the individuality of the patient, then CPR becomes the first choice of remedy. Thank you. Thank you very much. Yes, the breast size restored. And she is a very strong lady. She is taking her husband to multi-millions. She has taken the legacy up. So with that, I halt my presentation over here. Thank you all.
Thank you very much, sir. It's really a very good session. Since our time is already over, there is no time for question and answer session. We can have another session as per sir convenience later. Over to Shaluraj.
Okay, thank you, Dr. Muktinder Singh. It was very wonderful session. You shared a lot of information basis of your clinical experience about the topic of CURED case of breast atrophy with repertorial analysis and MATERIA MEDICA. Okay, we hope you come again this platform in future. Now we want to wind up this session, and our Malayalam session is going to start. I hand over this session to our respected Dr. Ganesh. Any
Everyone,
other one?
yes, thank you. Everyone, please note that you can use the same link for every day. We are having sessions every day at the same time from 8:30 to 9:30, the international session in English. There is no change in the link. Every day we have a different session. Tomorrow we will have a session from a dietitian, Amira Joseph. She will be talking about wellness in the workplace, practical insight for medical community. With that, we come to the end of the day, 1529. Thank you all. Thank you, sir, once again.